Hi, my name is Brian Biesick. I practice in pulmonary medicine just outside of Boise, Idaho for the Terry Riley Health Centers. This video series, we've been talking about COPD and exacerbations. In this video, I want to change gears a little bit and talk about important patient conversations. COPD, there's a lot in that name. It's a chronic obstructive disease. It's with them all the time, every day. I like to think about COPD like a wet blanket. It's with them when they wake up, when they go to bed. It's always present, and it can have a big impact on other parts of their life. It's not just a lung disease, it's a head to toe everyday disease. It affects where they go, what they do, activities, whether they go to birthday parties or go visit somebody. COPD becomes a factor in all of those decisions, and that can weigh heavily on patients. What I try to do is get a very good feel for how they are doing at the time of the visit. I ask questions like, can you go shopping? In fact, I just had a patient tell me she no longer carries the basket. She has to use a cart now because she needs the cart to steady herself. Well, really, she's using the cart to help support her chest muscles to help her breathe. That's important, and I would not have known had I not asked a specific question about shopping. Talk about those things like laundry and doing the dishes. Are they able to do them, or do they have to stop and catch their breath? Specific questions will help you be in tune to how they're doing and just how much COPD is affecting all these activities. Also, the more in tune the patient is to something like shopping, the more in tune they'll be when there's a change. If they're going to have an exacerbation, if things are getting worse, maybe the air quality is worse, if they're in tune to those things, they can reach out to you as soon as symptoms change. When thinking about COPD like a wet blanket, it can affect their mental health. It can lead to anxiety, depression, anhedonia. All those are very common in COPD, and I can't encourage you enough to connect patients to the resources that can help them. One personal story. My mom had COPD. She had a genetic form called alpha-1 antitrypsin deficiency, and she had severe COPD for the last 20 years of her life. I remember a conversation we had about her anxiety. She told me that the medications and counseling she was doing for her anxiety, and she had depression, was more important to her than her breathing medicines. That hit me hard. She felt like that part of her care, the mental health side, made a bigger difference than her breathing. She was on a ventilator at that time, and I know that she knows that the breathing medicines were keeping her alive. However, to her, those things were more important. Just sends home the story that we want to consider this as much as we can. I know appointment times are limited, but if you can at least talk about these subjects, bring them up, make them know that this is normal and the way they're feeling is common amongst patients with COPD, and get them connected to resources, we can have a big impact on their quality of life. The next video, we're going to look at the medications involved with treating COPD, all the way from inhalers to biologics.